Now we go into the question and answer period, and I will start by first asking, I guess, to you, Ms. Becerra and Dr. Rowland, what would it mean towards the region's overall recovery to lose these services that have been described so eloquently here this morning?
Well, I think that most importantly, the threat of backsliding on the progress that has been made so far in the Primary Care Foundation is something that we would not want to see. These clinics now and this Primary Care Foundation that's been built is in an expanding mode. It's in a growth mode, and reverting back to a less effective system where people would have to seek care in an emergency room would be more expensive and would yield poorer outcomes, as you've heard. In addition, like emergency rooms throughout the country, they're already at capacity. So it would be very dire to lose these primary care clinics.
Right. Dr. Rowland?
Mr. Chairman, I know your concern is for the people of New Orleans, and I think what these clinics have demonstrated is that they need access to care. There are severe gaps in their ability to get the care they need. We know that uninsured people get less care than those with insurance, and that they live sicker and die quicker. So I think it's an investment not only in the clinics themselves, but especially in improving the health care of the people of New Orleans. And many of the low-income population there suffer from multiple chronic conditions that are not readily available to emergency room care. So I think you really need to have in place a good primary care network and to sustain it.
Right. Thank you very much. Let me, I guess, raise this question with you, Dr. DeSalvo and Ms. Kraft, Kearney, and Dr. Irvin, and, of course, Mr. Griffin. As you know, the grant ends next year. I guess what federal assistance are you now seeking to be able to keep it going? Just sort of run down the line real fast as to what you're doing to sort of keep this alive. What are you doing?
Well, what we've done is work towards improving efficiency, quality, so that we are providers of choice for communities, irrespective of ability to pay. We work collaboratively in organizations like 504 HealthNet to ensure that we're sharing best practices, billing when appropriate, et cetera. So we're doing our best to be efficient operations. The reality is, as you heard, that can only go so far, including when patients contribute to their care, which they do. We charge sliding scale fees at these sites. And so the gap will need to be filled in much the way that hospitals have a gap filled for uncompensated care. It's just the DISH program doesn't support primary care federally in the way that it supports the hospital systems. So in terms of gap, it may be additional appropriation. It may also just be thinking about ways that we can use existing funds that we have, for example, CDBG funds that we got for recovery that are now at the LRA that are for urban renewal, principally for housing, but thinking about the fact that without health care, it doesn't make a lot of sense to just build housing. You have to have the fabric. So that's one opportunity for bridge funding, and then to think about whether we want to use a waiver for disproportionate share money to support the clinics going forward until it's not needed because there's coverage for everyone.
Right. They're right down the line.
The Lower Ninth Ward Health Clinic is moving towards sustainability by first making sure that we are Medicaid providers, Medicare providers, and private insurance providers. We came up a little bit differently because we came up post-Katrina, truly a grassroots effort. So we are putting those different things in place so that we can become more sustainable. Also, we are looking to the philanthropic community to assist us.
Mm-hmm. Dr. Irvin?
Yes, sir. Thank you. St. Thomas is a federally qualified...
Your mic on?
St. Thomas is a federally qualified health center, and as such, we get federal funds from that. As I mentioned in my testimony, that the financial base that's required to maintain the infrastructure so that you can comply with the policies and procedures and the 24-hour coverage and this sort of thing, we're working hard to try to maintain that. We have a sliding scale. We have increased our patient revenue, funds from patient revenues from 0 2 years ago, 3 years ago, to estimated $420,000 this year. Are also, the mayor of New Orleans has granted us $850,000 for CDBG funds, but this is a one-time only thing. We have a $2 million allocation from the state, but that's for capital improvements only, so we have to stay viable in order to be able to capitalize on that. We meet weekly, our staff meets weekly, and we go over ways that we can improve our sustainability with not only with grants, but watching our costs as carefully as we can, and we have, unfortunately, with a 72% uninsured population, it's just very hard for us to find any kind of viable revenue that could replace this money until there is some expansion of Medicaid. We're told that there will be a substantial increase in patients who are eligible for Medicaid, but this will likely take 2 years. That's why in our sustainability projections, we estimate that beginning year 3, should this occur, the beginning year 3, St. Thomas will actually be able to replace the $3 million that we would lose from the Primary Care Access and Stabilization Grant. We expect to be self-sufficient in year 3 on the business plan. And we, as I say, we charge everyone that can pay. We get a sliding scale. We ask the patients to take responsibility for helping us be viable. But when we're dealing with a demographic of 72% uninsured, it's really hard.
Right. Mr. Griffin, be briefly because my time has expired.
Daughters of Charity is focused on growing our insured population as we are 72% uninsured. Since Katrina, we have blindly accepted all who come, and that has been majority adults who do not qualify for Medicaid or uninsured. And so our payer mix is 72% uninsured. We are focused on growing arcade care and insured populations. We also are evaluating our expenses and looking at our care management model, which is pretty comprehensive, and seeing how we can be more efficient, and also looking at fundraising.
Thank you very much.